Okay, thank you for coming, everybody. I'm really delighted to introduce today Emmy Ugonya, who will be presenting a chapter from her book in progress. The book in progress is called Homosexuality and Masculinity in Kenya. And this is going to be a chapter of the forthcoming book. So we're very excited to hear this, Emmy. Emmy was previously with the University of Amsterdam Institute for Social Science Research, and she's currently a postdoctoral research scientist with the African Population and Health Research Centre, where she's working on challenging the politics of social exclusion, leading the LGBT segment. So Emmy, I should have mentioned, sorry, this is an IHSP, IGSF and ISID joint production. We're very delighted to have everybody here, and we're very much looking forward to the talk. So Emmy, go ahead.
I don't know whether to say here in Kenya is or Nairobi is good evening. And I think in other parts of the world could be during the daytime. So I can say good afternoon or good morning, wherever you are. Thank you very much for attending this session. I'm going to talk about gender-based violence in same-sex relations. And this is my outline. I'll start with the background, then move on to the theoretical framing and methodology and findings, and I'll use case studies, and then I go to conclusion. My background, how I started my work with LGBTQ or same-sex relations was through men who have sex with men. At that time, I was studying HIV support groups, and I came into contact with a group of men who have sex with men, and they were sex workers. And at that time, and still now, in Kenya, you find MSMs are recognized as under key population, but again, they're unrecognized legally and constitutionally, and they are stigmatized, and most of them, the ones I worked with, had cut links with their kids. And my first encounter was they were having a training, and it was about substance abuse and HIV. When I attended, the person who was actually leading the training asked them to do a self-concept reflection. And one of the participants actually was crying, and I was told, here we cry and we fight. So I was supposed to remember, here we cry and we fight. The third thing I was told is I should get a counselor, for the things that people are going to share will be so heavy for me emotionally. So I had to keep in my mind the fighting and the crying. But around that time, the discourse around men who have sex with men or LGBTQ was about HIV and human rights. Those are the main things they were doing. But in my group, it was offering social support and also mobilizing men who have sex with men, sex workers, to get the HIV services. So I never imagined that I would work on gender-based violence among same-sex relations, but staying longer in the field because I'm an ethnographer, things started evolving from just HIV and going beyond HIV and going into the real life. And that changed the single story I had gone with HIV, and I started looking at many things. And one of the things that I'm writing about is about gender-based violence, but we also have other issues I'm looking at. So I began working with them since 2010. I took some time for me to start recognizing gender-based violence. First of all, I used to hang around with them a lot, and I attended their meetings. I was still looking for crying and fighting. and we used to meet mostly in a bar in town, in Nairobi town, downtown, and a rundown bar. And that's where they were meeting. And one of the things they told me was that before they went to that bar is they had fought somewhere else, and they were chased away. So they were offered space in this other small bar we were meeting. And also they used to mobilize certain activities, especially when it comes to end of violence against sex workers, and also HIV, human rights violations against LGBTQ. And in one of the meetings we were having, we were gathered up in a hall, and the government, I think, yeah, we had also UN representatives. We had the government representatives from National AIDS Council, and I thought it was a safe place. Then all of a sudden a fight broke, and the people were running here and there. Anyway, the good thing is that I was legal in a illegal place. So what happened was, what happened in that meeting is the first time I saw the fighting, and I thought maybe this is the way they fight. And that continued, but I never realized anything on gender-based violence until 2013 to 2015. I started noticing there were things that people would talk about, whisper about, and then you see, okay, they're talking about beating the wife or locking the wife somewhere. And I was like, okay, maybe I should also say that in this men who have sex with men, they actually mirror the heterosexual relationships. So you hear the man or the woman, the wife, the husband, the girlfriend or the boyfriend. So the first gossip I had, my friend Musa was locking the girlfriend in the house. And this is because I came to learn about this issue because Musa was very ill and was supposed to be taken to hospital, but he had refused to be admitted in hospital because he wanted to be the girlfriend with the wife. So what happens? He ended up locking the wife in. He ended up not going to hospital, but we had to ask him to leave the hospital. Later on, the friends are the ones who told me that he's been locking the wife in the house. He didn't want the wife to get out of the house because he was afraid they are going to steal the wife from him, or the friends, other MSMs, other LGBTQ will actually steal the wife. So, but I never even thought about that was also gender-based violence. And then I left Nairobi, I went to Mombasa, and I met, in Mombasa, I was doing work on HIV actually, and I was interviewing a group. And whenever I was in Mombasa, I was meeting my participants in sort of a house, but it was a brother sort of. I would hire it, and then we have meetings because it was difficult to find a place where I could have meetings with them due to violence against targeting them. So in Mombasa, I had interviews one day, Saturday actually, I had interviews running from 11, and at 7, I wanted to, there were in-depth interviews, I wanted to stop because I felt I was exhausted, and 2, I was using the language that is commonly used at the coast, the Swahili, which is a national language for Kenya. And in Mombasa, the Swahili that is spoken is so nice and is so good. You listen to it, and my Swahili was not so good, so I was struggling, and I was just fed up of it. So at 7, I had closed the interviews, but one person came in, and whom I call Queen, he came in, and I was told you should interview him. But by the time he was entering, somebody else in the meeting, because I was given a room and they were in a living room. Other MSMs I had actually interviewed were in the living room, and we were preparing maybe after my interview that we can have a meal together. So I had somebody shout at Queen saying that, why are you here? Why have you followed me here? And actually Queen himself or herself looked more of a street person. You could look at him and you see he had these clothes that looked like he's a street person. And I was wondering, why are they letting, because they had told me this is a place for maybe middle class. And I was wondering why they let Queen to come in this meeting. But then I was told by the host, who was now my field assistant, that I should interview him. So we went to the room, and actually he had swollen face. He's been beaten, he had some blood, and I was wondering what was going on. But when I talked to him, he was very eloquent in English, and I was taken aback, wondering, I mean, this is not, you can't be coming from Mombasa and you are speaking English to me. Then he told me he came from another town, and he didn't want to talk about what had happened to him. As an interviewer, I didn't want to push him to tell me what was happening. So later on, I asked him a question, if you are HIV, no, if he's tested for HIV, and he asked me, if I'm HIV positive, what will I do? And I said, you can go for treatment. Then he told me that we shall talk later. At the end of the interview, he gave me his number and told me he would like to talk to me later. Then I found, I actually asked my field assistant who was hosting us in that place, what had happened to him. Then I started hearing now him telling me about how Queen is really beaten by the husband. Is really beaten by the husband, that Queen came to Mombasa, or to this town, when he was actually a very educated man. He was working as a lecturer at a university, and he came to this group to teach them about computers. So they really liked him, but he landed in the wrong hands. That's what he said. So Queen was really beaten by the husband, and I started wondering, this happens in the LGBTQ community, because I had never heard about it. I found out that it's a very silent topic. When I went back to Nairobi and they brought a group together to find out whether this is happening, I had a group of 7 and we were discussing about it, and they told me it happens, but it's silenced. Nobody talks about it, and nobody seeks any help anywhere. You'll see people getting, like, somebody is so depressed, so stressed, but it happens, and it happens in various forms. So this actually marked the beginning of me paying attention into gender-based violence around this, and started looking at ways and forms of gender-based violence amongst same-sex relations. When I looked at literature, very little had been written, but Barros and the group have done systematic review, and there were very few studies done, especially in Africa. We only had one study done in South Africa among the lesbians and gay. And according to studies that have been done, there was no consensus on the same-sex intimate violence, which is part of gender-based violence. And also, the main those ones focusing on gender-based violence are mainly among the lesbians and transgender women. But you'll find very little or no information on other groups, like men who have sex with men, that is gay and lesbians, and yeah. So if I looked at the policies and strategies in Kenya, actually, we are very progressive when it comes to gender-based violence, but again, it's very silent on same-sex relations, perhaps because Kenya, same-sex relations is criminalized. And then I looked at the services that are offered. We have the medical and the legal and trauma counseling services that are offered for gender-based violence. And also we have integrated one-stop centers where we have all these services in one roof, under one roof. And then we also, the providers are public health, and we have 5 NGOs. And none of these actually focus on LGBTQ or same-sex relations, except one NGO, Liverpool Health, that has services that target or focus on LGBTQ, but also the services for gender-based violence are very limited. Then the other thing, when I was asked to present on this forum, there was a lot going on, and it was the COVID time, and a lot was happening, and most of the focus on gender-based violence was women and girls, and perhaps transgender women and lesbians. And despite the impact of COVID-19 on sexual minorities. And I wondered, does it mean that there's no gender-based violence against same-sex minorities, especially men who have sex with men? I looked, and then UN actually, they even had a campaign, but it was also focusing on women. And they put it there, violence against women and girls is human rights violation. And I kept on wondering, but what about the violence against the gay and bisexual men, or men who identify as men who have sex with men? And then there was also a human rights campaign that to end 16 days of activism, violence, 16 days of activism to end violence against women. And I'm still wondering whether there were actually, these women were inclusive of the feminine LGBT, feminine, gay and bisexual men, and men who identify as gay, as having sex with men. And so I framed this through gender. After looking through how I could actually frame this, I realized gender-based violence is what I was actually looking at. So I tried to frame it through understanding of gender, gender roles, and gender-based violence itself. And mostly it is targeting the women, although it is actually defined as inclusive of men. And then the sexual and gender-based violence. Sometimes it's gender-based violence alone, but also it is inclusive of sexual violations. And I use the UNHRC definition, and you find that this one actually expands and says that it inflicts harm on women, girls, men, and boys. But I didn't understand whether the men and boys are heterosexual or homosexual. And they say that this is a human rights violation. But I never heard, even before in gossips, that when we were having all the activities with men who have sex with men, sex workers, or sometimes we met with the rest of the groups of men who have sex with men, and also we could meet the transgenders and lesbians, but I never heard gender-based violence being discussed in the human rights space. It was never mentioned. But mostly when you look at all gender-based violence, it focuses on women. And then you look at what else could be causing this, or how is it being framed in different spaces. So I found I should also look at masculinity and see how masculinity plays out. And then I also looked at conflict theory, and then you look at intersectionality of masculinities, identity, homosexuality, heteronormativity, patriarchal, and gender roles. All this contribute to gender-based violence. So my methodology, as I don't know if I've said earlier, I'm an ethnographer, a medical anthropologist, ethnographer, which means I stay in the field for long. And for this study, it started 2010, and I've been following it until 2018. Just having observations, we do participants observation of being in their space most of the time, or what we call insider, outsider. Outsider was researcher, then I went in as insider as well, because of the deep hanging out that we do and stay with them in their spaces, actually, in their real life realities. And then apart from those observations, which I do with them, mostly hanging in the spaces, I actually use conversations. We can have conversations with different individuals, or if there was gossip, then I want to open that up and then I'll try to find out what is going on and what happens. And then I also do informal group discussions. Like when I left Mombasa, I came to Nairobi. I first had a group in Mombasa to hear what was going on gender-based violence, whether it is real, whether it has been happening. And then I came to Nairobi again. I had another discussion with people, with my group participants in Nairobi. And then I decided, okay, I want to look for people who've experienced gender-based violence to tell their stories. And within a short time, I actually had 15 in-depth interviews of people who 13 of them had experienced gender-based violence, but 2 of them who I interviewed, they came as those who had experienced gender-based violence, but in their talk, they were actually perpetrators as well. They had gone through both experiences. And then how I collect my data was through consultations. At some point, being insider, I was invited to support somebody, actually to advise one of my friends or participant who was going through gender-based violence. He actually, he approached me and told me that I should help him. And for me, I was feeling, no, I have no idea how this goes on. And the only program I had about people being taught to be gay was in South Africa, and I hadn't heard of any other program, especially in Kenya. So while I resisted, he told me that I was the only neutral person that he can confide in, and I have to work with him. Initially, we didn't know it was gender-based violence, but at some point we realized that it was gender-based violence. So as a researcher, I became the other side to help, but at the same time, then it becomes a thin line between being the other side and being researcher. But we try to observe and make sure that you know your boundaries. So the forms of gender-based violence I experienced was intimate and domestic gender-based violence, intimate partner violence, and then physical violence, verbal abuse, isolation or deprivation of freedom of association, psychological, emotional, sexual violence, or they call it humiliation, economic violence or denial to resources, and stalking. And I want you to imagine that we didn't have, the way they have been brought up, the men who have sex with men or LGBTQ, is they have been brought up in heteronormative communities, patriarchal communities, and that is what shapes them. And that is what shapes the relations. They have grown up in these communities that they know, and that is the way they are brought up, and they'll carry this into their relationships. And this heteronormativity or patriarchal, they emphasize on gender roles, power, and masculinity. And I want you to imagine their relationships just the way you imagine heteronormative relationships, that they mirror that very well. They have those arrangements of male, female, she, wife, he, husband, boyfriend, and them they use. I know in other parts of the world they use partner, but in my community, my participants only used them to refer to male, female, or husband, wife, boyfriend, girlfriend. So they would say, okay, that's my girlfriend, that's my boyfriend. So you'll know who is who in the relationship. Subscribing to partner, it brings some equality into the relationship. But some, when I ask them why, sometimes they use partner for those who do not want that binary being the other side or binary line to show that they're this side or binary identity, or but for fear of losing masculinity privileges. I remember I asked one gay friend of mine, one gay man, and he was quite feminine, and I asked him how he identifies himself and why he can't just move on and be feminine and just be a she or a wife or a husband. And he told me, no, I'll lose my masculinity privileges. I still need them. So I'd rather be a partner in any relationship. So it varies. And then, so forms of what I experienced, you'll find I've talked about masculinity and provider power. So in most cases, you'll find the masculine men, how the masculine men, they actually mirrored what was in a patriarchal or heteronormative community or society. And they want to use their power, that power, to control the she partner. And so some of them are very violent. They'll beat, actually mostly they beat. So you'll find like Queen, who was very smart, very educated, is a provider, but still the same, that does not give him a leeway to have this equality or resist the violence. But the one who is the husband, who is tall, who is physically well built and was the darling of everyone, is the one who is very violent and can actually beat Queen. Like the lecturer who was, the guy who was a lecturer ended up just losing the job because now you are rejected and you lost the job and you can't go you can't go to work because people will be asking you, who is beating you? Why don't you go to report? And here it is, you are in a relationship, or you yourself identify as the other criminal, the criminalized other. So you cannot seek this service. So you just live with what you have and you endure what you can until somehow you have to be saved from this wife beater. But at the same time, what I came to actually learn was that the masculine, even if they were violent, they were really liked. They could beat, they could do things that you could see that is not okay. You are violating somebody, but still the same, they were really liked by the female. So the female would endure all that kind of mistreatment, like the one who said is feeling bewitched, He says he feels bewitched, he can't leave the relationship. So you find that they are really, the feminine are really beaten, but they still, that maybe they're the ones who are the providers, that won't change the relationship, but they really be beaten and they'll hang on until somebody saves them. Then we have also in other relationships where money now becomes the stepping stone to violence. And you find some of them actually face when their partners have resources and these partners only takes somebody they want to keep in their houses. They'll give you everything, but they don't want you to go to do work. You'll stay, most of them like our homestay wives or girlfriends, and then you are denied you are denied resources, and you are beaten, you are physically abused, you are psychologically abused, and yeah, you stay there and you lament, like Maggie, the way she lamented that I've been in 3 long time abusive relationship, one after the other, and all ended up on a bad note. I'm psychologically and physically abused. I'm the wife there. Yeah, so he only takes care of household chores. I don't have a source of income. I depend on them. And you start a relationship, after some time there's disrespect, and in 3 cases you find maybe your partner or your wife or your husband is actually dating somebody else, and they'll bring people in the house, and also at some point they'll tell you get out, of the bedroom and go to the living room, and what they called, actually they were being sexually humiliated because they have invested all their energy into this, all their emotions into this relationship. But that does not matter, especially once this start happening, then you are actually emotionally abused, especially with the ones who have money. And it will be even worse for one to have money and then have also be masculine. Now you'll suffer more. And then there was this other practice of group sex, that you have a partner who will bring, at some point will bring in the house a group of friends, and then they'll have group sex. And you are here in a relationship, and he even promised that we should have rules, and this should not happen. Don't bring somebody in the house. Actually, it's telling you not to bring anybody in the house, but them, they break the laws and the rules, and then they start bringing somebody in the house. And mostly these are the ones who are brought in as we stay home, like Jacinta lamenting also about what happened to her, to her or him. What happened to this relationship, that he loved the person, this was his first lover, and then with the head rules, and he was okay with it until he realized the man is bringing people in the house, and he was also being kicked out of the bed or the bedroom. And when this is being shared, it just reminded me of in some community called the Pokot. I had done my work there a long time ago, and this was seen as gender-based violence by women, because the men, they used to have a dance in that community every end of the month, and men would go there. And sometimes, if you feel, the men who are married and they want to get a new wife, they would put an earring they put on an earring, and then they go to dance. And then when they come with a new catch, they'll ask the wife, get out of the bed, sleep on the floor. And then because their houses were one room, so a small tiny house with a bed. So when the man comes, and then you get out of the floor, and then you sleep you get out of the bed and you sleep on the floor. And so I was seeing, this is actually what is happening to these guys with this group sex. You cannot just come in the house and throw somebody, today I've come with a beast, and that happens. And especially those who've invested in this, emotionally invested in these relationships, and they have been stay-at-home people or stay-at-home girlfriend or husband, and then you find you have nothing and nowhere to go to, and you are thrown out. And then it's so merciless that you are just told you have to leave, and there's nothing you live with. No job, no income. So if you don't have friends, you won't have anywhere to sleep. And then we have emotional manipulation. Emotional manipulation, and this I was talking to Joseph. Joseph is the masculine. He enjoys privileges, and he knows his responsibilities as a man. And he told me that I'm actually masculine, I'm a man, but I'm attracted to the ladies. So I'm not the lady, I'm just the man. And then he was lamenting to me about being manipulated by the wife. And he feels that in the house, they have roles and responsibilities, chores, who should do what. For him, he was the provider, and he cannot be told to do the wife's what the wife should be doing or what women do. He should just remain as a man. So he felt that was the wife was actually manipulating him emotionally to change to what, or maybe she makes noise about what you do, and many other things, whether the roles in bed or the roles in the kitchen. And so he felt like he's being emotionally or psychologically manipulated. And when I was talking to him, I asked him how he manages this. And he says that when it's too much, he also just slaps. And I was wondering, but that is also gender-based violence. You are beating your wife because she has refused to do the chores, you are not helping. So you find such kind of, maybe they're pushed so much that you decide, let me just slap the way because I'm the man, because I'm masculine or something like that. And then I've talked about the fear of the wife being your partner or your wife or your, especially the wives or the girlfriends being stolen. What is interesting, there was no fear of the masculine men being stolen, by the way. Even if they, yeah, so there was no fear, but there was fear of, if I have a wife, will be stolen. And that wife, now you'll stop the wife from participating into economic activities, like Jemima, who stopped the wife from doing his business. He used to do business. He stopped the wife from doing business. He told the wife to stay in the house. And then he looked at some point when Jemima was working, he decided that he's going to lock the wife in the house, so that when he comes, he just the wife to himself. So you find the wives being isolated, you cannot have contact with the outside, you actually cut links with everyone, and you are closed in the house. And there's nowhere to report all these kind of things. It will be now your perpetrator to come and open the house. And if he's going to follow you and see, or you go to the same places together, but there's no interventions towards that. And then there was also still homestay people. This was very prominent. And this is now Queen's husband becomes, yeah, he now experiences gender-based violence. Apparently before he was in a relationship with the Queen, he was actually in a relationship where he experienced gender-based violence. And he was actually locked in the house. He was told not to leave the house. Everything was brought to the house. The house was rented. And this prominent man had another very posh house elsewhere, but this was specifically for Queen's husband before he became Queen's husband. So every bills were actually paid, and everything, as long as he doesn't have any contact with the outside world, no friends, no social interactions. So one day the friends come up and convinced him they could go out and have a drink or something. The moment it was known, he was told to leave. You know, he's leaving, no job. And fortunately, at that time, it was not COVID time. So he had some friends who took him in for some time before he left. So, and then there was this psychological way and abuse and verbal abuse, which I did not understand. It was gender-based violence. My friend whom I worked with in this journey, he was told by the husband that you should fight hard to keep me. Actually, the husband was very, very, very handsome, very, very handsome, by the way. So initially, the first time I was called, my friend Mary called me, and it was about, they had a consultation about whether the husband should take up a job in another town. The husband had been pressurizing or telling him he has to leave, he has to go, but Mary was fearing that he'll lose him. So Mary would say, no, I don't want you to go, until it became so bad and violent that Mary called me and asked me whether he should let him go. So I told him, no, let him go. If it were you, what would you do? If somebody is going to do that to you, it will be very wrong. So let him go. When Mary told him that now you can take up that job, the man after one day said that he's not going. He's decided not to go. That was the first time. The second time he called me, it was these technical appearances in the house. He comes, he disappears, then he'll come again and he disappears. So Mary called me again. I told him, okay, you should ask him whether he should stay. He wants to stay or he wants to go. The second time he called me, it was over gender roles. And this one, Mary told me, is so bad that she's the one who is providing. At the same time, she has to do all the gender roles, even washing clothes. You know, here you use water and you wash clothes. And also she's paying for everything in the house. So she was wondering what was the use of having this husband in the house who cannot provide. She even went ahead to suggest and open, I actually suggest that he could open for him some business, but the man said, no, I don't want business. And also the other thing, he would bring friends in the house. And this was all to be taken care of by Mary. And when Mary started asking him about these questions, about his roles, about gender roles, even washing things and cooking, he became very abusive with all this, and Mary was trying to keep him and keep this relationship. I told Mary, I think you are going through gender-based violence, although we have taken long to know about it, but you should get out of that relationship. At this point, he was actually very anxious, and Mary was very anxious, was becoming anxious all the time and calling me all the time. And I said, look here, what you should do, just stop that relationship. He actually stopped the relationship and actually became more happier. Now, after that, now we have COVID. And when COVID struck, actually a week or something in Kenya, some participants of mine in the field, you know, these have been my long-term participants. They called me and told me that they were being hit hard by COVID, mostly if you are a sex worker and you are trying to get money, and the lockdowns and the social distancing and the risk, then they didn't have business. So, but then I was wondering when I could see gender-based violence, what is happening to those who are experiencing gender-based violence. So I was told of one actually who was chased from a relationship and didn't know what to do, and did not, you know, now he became homeless. He doesn't have anywhere to go, because even them, most of them were homeless, but they would, when they do sex work, actually, they would bring resources together and then hire rooms where they would sleep, or you sleep in the park. So I was told that the social suffering has really intensified. But then when you look at access to gender-based services, which I've already listed above, you find none of participants, whether before or during COVID, had access to sexual gender-based violence. And this could be in part because of criminalization of same-sex relations. You can't go to police officers to report you are in same-sex relationships. Although we have had projects where police officers were trained, but there's always this transfer of police officers from one point to another. So it becomes very difficult to go and actually report and seek services when you are criminalized. And then I found out that there was lack of information about the services, and then and feelings of humiliation. Some of them would feel like, I don't want to go. They don't even come out. It just be gossip, and they don't even want to go and seek services. And then there was fear of victimization by healthcare providers and other authorities. I remember one gay person told me, I have no problem with seeking HIV services, but I have problem to seek services of any other condition that will reveal a gay person. And then now I've talked about criminalization, prohibitive policies. And then when you go to the sexual gender-based violence services, you have to get a P3 form, that is the legal. You have to get the T3 form from the police. They'll fill it, but you also have to get a medical report. And, and then there was a lack of awareness about the services, and none of the LGBTQ-led organizations actually offer gender-based violence services. So in conclusion, I would say there's a challenge actually when it comes to gender-based roles and in homosexual relationships, and these can cause violence among themselves, and also gender-based violence actually shows inequalities and insecurities, and there should be more research. And when you think about sexual gender-based violence in heteronormative relations, also think about women and men in same-sex relations, especially the G and the B. Thank you. Yeah, and then now my acknowledgements goes to the University of Amsterdam Becoming Men project that actually I did most of the work when I was working under this project by Eileen Moyer. And then my current organization, FHRC, and at FHRC, I have had discussions over this with Michelle Mbudia and Florence Pala and Meg Moka. Thank you very much.
Thank you so much, Emmy, for this really fascinating presentation, which I do agree with you. I do agree with your conclusion that it really sort of challenges us to think about gender roles, and especially the internalization of gender roles. So it's absolutely fascinating work. We do have time, about 10 minutes for Q&A. So we have some questions in the chat. If you have questions, please add them to the chat. So I'll go through some of the questions. The first question is, how long have you operated in the field with MSM? And have you noticed cultural changes over that period of time, such as worsening gender-based violence or improving gender-based violence, greater social mobility, worse social mobility? So that was from Mia.
Can I go, or there's
yes,
another
go ahead,
question?
Go ahead, yeah.
I can go. Mia, thank you very much. My first encounter, I think I mentioned, was in 2010, and I've been around MSM's first MSM sex workers. Then I moved on to LGBTQ to include all other groups until right now. So you can imagine how many years I've been working around LGBTQ. And as I said, I started my entry points, my entry point was HIV. But that now I moved beyond HIV and looked at other issues that affect their lives or their life in a comprehensive way. Thank you. And when it comes to whether it has worsened, actually, there are no services. I've said that they don't access services, they don't come out. It hasn't really worsened, or it hasn't improved. It's still the same.
Great, thank you, Emmy. A second question here from Elizabeth. Is it only the wives or girlfriends that are abused? So is it only the people who are, you know, taking on those gender roles that are abused?
Thank you very much, Elizabeth. About wives, and mostly the wives and girlfriends are abused, especially if you are stay-at-home girlfriend or wife. But still the same, that we have a few cases where the men are also abused, especially if you find a woman who has money can also abuse you. Like I mentioned one person who was feeling manipulated by the wife because of being told to do the roles of women, and he felt like he's not a woman, he's a man. So that way it was conflicting with what he feels that he is, and that way he felt that he was being abused. So you'll find some, we have some men, but there are very few. And masculine men, like the masculine men, like masculine men, yeah, masculine men are most likely not to be abused unless it is not physically, but emotionally they can be. Yeah.
Thank you. A question from Agat here. Do the masculine MSM identify as gay if they are attracted to the femininity of their wives, or do they rather identify as MSM?
Now, you know, MSM came with HIV. It was a terminology that has been used to mobilize men who have sex with men and plus. And when you go into those, to the MSM, you find the also categories of them. And so you'll find even gay in that when it comes to HIV, they're just like, basically the MSMs, but when they now want to identify separately, then you have the LGBTQ. So the MSM is a terminology that brings them together to do something, and that something is to mobilize them around HIV. But then inside there, we have different communities. So they start organizing themselves along the small communities like lesbian, gay, bisexual, or yeah, so they have those differences. Whether they are masculine, yeah, we have many of my MSM sex workers who actually identified themselves as gay. So they would gay feminine or gay masculine.
Right. Mm-hmm. Yeah, that makes sense. Thanks. A question here from Kevin. Why do you think most of the abuse inflicted on MSM relationships is mainly psychological or manipulative? Do you think there's a link between past cultural behavioural experiences and the abuses in the afflictors?
Definitely. That's where I said you have to think of how they have been brought up, which culture has brought them up. They have never had a session or anywhere where they have learned about how to be or how to be. You are taught, you are inculcated in this community, and you know this is the way things work. When I'm masculine, this is the way I should act. When I'm feminine, this is the way I should act. And when they come into that relationship, they actually just carry that into the relationship and mirror their relationships onto that. Especially the masculine wants that to remain. But then the masculine who don't have money may not be providing. So it happens also in heterosexual relationships. That's why I said that you think about the relation, think about the heterosexual relation is the same. The difference is this is same sex and the other one is not.
Mm-hmm. Thanks. We have a raised hand from Sharon. Go ahead. If you could. Yeah, go ahead, yeah.
Thank you, Emmy. What a fascinating talk. I was just wondering, given the criminalization of the relationships, that means that essentially there are no consequences for this abusive behavior. And it's not a great surprise then that people would not want to come forward or not access services because they might be outed, and therefore yes, it's a criminal offense. So I'm wondering how, I can only imagine how difficult the work has to be if you're fighting that system, in contrast to, let's say, North America, where it is legal to be involved in a homosexual relationship. And if there is abuse, you can report it. Some people may choose not to, but it's not inconsistent with the criminalization. So how much of a role do you think the criminalization plays in that?
Quite a huge role, actually. In fact, even the perpetrators use that to abuse them because they know they can't report anywhere. So you can't report anywhere. How do you go to the police to report what? Are you going to take yourself or to out yourself or to report what actually? So most of them, whether, and you know, there's, as I said, there has been no any awareness in the community to show this is wrong. There's no organization, including the LGBTQ led organization, to bring that to the fore. Nobody's talking about that. We talk about human rights, and this is a human right, but it's totally neglected. Nobody talks about that. And I've also said it's silence. It's something that you'll hear in gossip. So as a researcher, when you hear and the people tell you and you follow up, and then you find, oh, this is happening, and they'll tell you nobody talks about it. I don't know if I've answered your question, Sharon.
Yes, I'm just wondering, how do you see the way forward if these powerful groups have not been able to mobilize anybody legally? How do you see that changing?
I'm thinking I think that's why I said that there should be more research to be done around that, so that this can be seen as this is what is happening. And in some of the meetings I've had with a few leaders, I asked them whether they have any plans for this. But you see, because there's no money that have come in for gender-based violence, since there's no research done on it, so that is not the focus. Here, people follow money. What is now, if COVID is working, then there's money in COVID, we shall go there. If it's human rights, we shall go there. If it's HIV, we shall go there. But with time, what I've seen, like in HIV, they have started to change. No, we want to go beyond HIV, not just being HIV. So with time, maybe as studies come out and people start talking, maybe now they'll look at it and see they should do something. What I've seen is a call for mental health. Maybe if there's a call for mental health programs, then that is going to help. There has been a lot of call during this time of COVID for mental health in the community of LGBTQ. So I think if that happens and they have a place to report this and discuss, then that will be a different thing. I remember Mary telling me that I should open a place where I should be offering counseling to those who are, or just listen and give advice. But I'm a researcher, so I couldn't open a counseling clinic for them. Yeah, thank you.
Thank you, Emmy. We've run out of time. There are still several more questions in the chat. Anaik, do you want to advise me as to whether we can take a couple more minutes?
Emmy, do you have a few minutes to spare?
Yes. We can take the questions.
All right.
Okay, great. Thank you so much. So there's a question from Martin that I haven't got to yet. It's more of a methodological question. It's this one: as a researcher, is it a good idea to advise someone or a partner to leave a relationship?
Those are some of the things I have to grapple with. When you are an outsider, then you come in, you are an insider, and they start looking at you like you can provide. Because when you are in that space, actually, as you study them, they are studying you, and they see what you can provide and what you cannot provide. It wasn't the appropriate thing to do. I resisted, but I was told you are the only one who can help me. What do you do? So they tell you, okay, just listen. Because I remember telling Mary that I have no experience with same-sex relationships. I only know heterosexual. So I could give you the advice following my way of life, but he's told me, no, just listen and honestly just tell me what you think. So it wasn't the right thing, but we've done that, starting from my ethnography, actually hanging around. I've actually been working sometimes as a researcher and a social worker, because I have to connect people from one end to another for services. When you get to a client or your participant and you feel they need this. So we actually do that. So when it comes to that relationship, I saw Mary was being depressed, and we had actually tried, she had really tried, and some of my advices were not working except the first one. So the only thing is that I looked at it and told Mary, look here, you are actually under gender-based violence. So you either stop it or you leave, because the man had moved from just being that one she has to fight for, to the one now you have to, it was abusive, I mean verbal. Now what next was coming? And it was just a struggle, calling me at night, telling me what is going on. And I just said, leave the relationship. And actually he told me he was more happy after he left the relationship. At least there was no tension. I don't know if it's the good thing to do, but it's some of those things when your participant now see you are the only one who could, and actually I couldn't advise, I didn't have anywhere to tell him go to this place. And the only people I suggested, maybe you can look at this, the organization's leaders of LGBTQ communities. And he told me in the community, people steal other people's girlfriends or boyfriends. So if he approaches somebody, he might be stolen, you know. So yeah, so those kind of complications. What do you do? Do you keep quiet? Do you leave them? But at the same time, this is your research, you know. This is your research.
Yeah, thank you. I'm going to just ask one last question and then we'll probably have to wrap it up. And I'm going to give it to Mia. Several people asked second questions. I'm really sorry we didn't get to your second questions, but Mia has asked several questions. So I'm going to ask her one of her other questions. So this is it. Do you note any degree of emigration from Kenya by MSM due to all that you've discussed? Or do financial, social factors stop basically everybody who might wish to do that, wish to emigrate?
Thank you, Bia. Immigration, I've not seen. Immigration, I've not seen. When I went to the community, the first thing why I was accepted quickly is because I was coming from Amsterdam, and everyone was looking up to me to help them get, they thought maybe I would connect them to clients in Amsterdam or help them get to Amsterdam, until they realized that even that time I was meeting them for the first time. I had not known the community, LGBTQ community in Amsterdam. Then that ended. So I remember they want to leave, but because of financial issues, they have never left. So you'll find most of them stay in Kenya. And you know now, international organizations, they only help those ones who are senior activists. Those are the ones, if they have a problem, I think they have a program where they can evacuate them or take them wherever they are. But now the common person doesn't have that privilege. So they just stay in Kenya. But we have had migration from Uganda and Rwanda to Kenya.
Mm-hmm.
Yes.
Thank you. And thank you so much, Emmy. That was an absolutely fascinating presentation. Look forward to the book.
Thank you very much.
Thank you so much.
Thank you for having me.